The purpose of the End Hunger Pain Initiative was to raise awareness of the growing rate of food insecurity in America and how it disproportionately impacts people living with food intolerance.
It's a stigmatized condition. They're embarrassed to talk about gas and bloating.
Onion and garlic free. So for people that have onion and garlic sensitivity, reflux, IBS.
And I've been recently wanting to get involved, particularly to help people with the intersection of food insecurity and food intolerance.
We took an airstream full of special diet foods down the East Coast, meeting with food pantry workers, healthcare providers, to really raise discussions and share experiences so that we can learn how best to help patients living at this intersection.
Food pantries now are a staple of our food delivery system in America. In 1980, there were 200 food pantries in America. By 2000, there were 400,000 of them.
And throughout the years, we've noticed that people will leave food instead of taking it all. But the reality is, what you said to me is that you're giving food away that people can't eat that will make them sick.
And so there is exponentially so many more individuals that are out there starving, and their children are going to bed hungry. This is a national problem for hunger in general, but with celiac disease and the gluten-free diet, that's medication.
As a dietitian, it's really important to me that we're giving people food that they'll actually eat, because it's not nutrition until you consume it. We partner with people like Geisinger Health Plan and Health System, PAC Pediatrics, where they screen for food insecurity and they refer their patients to us. And once the patients self-identify, we can work with them on making sure they're getting appropriate foods that they could actually consume for disease management or disease prevention, and that also includes their gut health too.
Food insecurity is so vast. So how do we shift from you have enough to eat to you have the right food to eat for you to be healthy?
Exactly. And for me, it's like it's beyond just like being good for you, but like that actually
Nourishes you.
Right?
It has to nourish you. It's
Doesn't
mind and
cause
body.
pain.
Right.
The last stop on our tour was Charlotte, North Carolina, where we met with Atrium Health healthcare workers to discuss the intersection of food insecurity and food intolerance and how healthcare providers can make a difference.
At this clinic, we serve the underserved, low-income community. So we see a lot of food insecurity, and we do screen all of our patients for food insecurity.
Kind of starting from that framework as we're working with a patient, not necessarily for the patient. And so coming to an understanding that the patient knows what's happening with their body. So if they're telling you that they're having sensitivities to food, starting from a framework, I believe you, let's see how we can work through that. Can we work towards a diagnosis?
So that's where I come in, provide the education to the patients to help identify certain dietary patterns that they can follow that will help symptoms. Once they have that education, we're kind of arming them with those tools that they can then take to the food pantry and make their choices.
Some people may view it as though someone's being a food snob or they're being very picky. But if you eat a food that's going to cause you harm or put you in pain, that does the opposite of what our intention is. We want our clients and patients to be not only fed, but we want them to get good quality nutrition so that they can live productive lives, right? You can't be productive, or you can't go to work, you can't go to school if you're in the bathroom most of the day, or you're cramped up because you're in so much pain. So that's not our intention at all.
We weren't doing this 5 or 10 years ago, and now I see people like you. It's suddenly there's this awareness that has really, I think collectively could really impact big populations of people.
And focusing on being a team on behest of the patient, so working with dietitians, working with community resources and the practitioners, I think all of us together, we can make some real progress on an endemic problem for our country.